Welcome to the informational video presentation, Preparing Students for Career Success in the Health Information Technology Program. We are accredited by CAHIM, the Commission on Accreditation for Health Informatics and Information Management Education. We will help you grow professionally, work toward a career, and you can do this and enjoy a flexible schedule. We are fully online. We understand that flexibility and accessibility is important. You will be taught by quality instructors who are experts in the field. You can read about our faculty on our HIT webpage, Health Information Technology Faculty. We will use a multimedia approach utilizing various forms of media, such as videos and interactive simulations, to enhance understanding and engagement. You will discover the variety of health information management career opportunities. You can find some career opportunities on our HIT webpage, Occupational Outlook, and Career Map. You can start in any semester. Our program is not structured as a cohort or a lockstep model. We are an open admissions program, no application necessary, just choose us as your degree. You can come part-time or full-time, your plan, your choice. But we do recommend for you to complete it in 3.5 years. We emphasize essential functions such as computer skills, communication, critical thinking, and self-management. You will have access to many support services such as the library, tutoring, IT technical support, and many more. You can find more student resources and services at Student Support Services. The cost is $739 per course, subject to adjustment. There is more on cost, and it can be found on the OTC webpage, Required Tuition and Fees. Working toward a career can be done in a couple ways. You can do it in our 2-year degree of the Associates of Applied Science. Our curriculum will prepare students for a career in the health management industry. As a health professional, you can work in a variety of healthcare organizations, such as a hospital or healthcare clinic. That just depends on your job role, that you can ensure the quality of health records, assemble and analyze patient data. You can participate in release and access of medical information, and you can compile and maintain data on patients and also code patient records for reimbursement and research. We deliver the academic curriculum required for students to pursue the Registered Health Information Technician, RHIT credential, from the American Health Information Management Association, AHIMA. This credential is highly valued and it's recognized by employers. 80% of our students who took the credential exam last academic year passed on their first attempt. The pay varies upon job positions, credential, experience, and location. Currently reports a pay range from $31,000 to $75,000 in the United States. You can also do our 1-year certificate, which actually can be done in 32 weeks, the medical coding certificate. As a medical coder, you can also work in the medical records billing department of a hospital or other medical facility. You are responsible for assigning medical billing codes to each treatment and procedure performed for a patient so that the claims can be billed or filed. You also examine patient records and use your expertise to correctly code all diagnoses and procedures. We deliver the academic curriculum required for students to pursue the National Standard Coding Credential, the CCS or CCSP, from AHIMA. This pay also varies upon the coding position, credential, experience, and location. Currently reports an average hourly rate of $26.36 for a certified medical coder in the United States. Do not confuse the OTC coding certificate with a national coding credential. Let's talk about the course expectations. We have an 8-week course format, and we have a suggested course sequence. We offer courses in an 8-week format to facilitate timely completion and cost efficiency. You can see these on our suggested course sequence, which is also provided to students so they can plan accordingly. The sequences for the coding or the 2-year degree programs are found on our website at Suggested Course Sequences. The grading requirement is a tough one. In health information technology, a passing grade is set at 75% or higher, and that equates to a C grade or better. This standard ensures that students have a solid understanding of the material, and it prepares them for success in their future careers. We have a repeat course policy. What if I have a required course taken over 5 years ago, you ask? while the only required courses to be taken within 5 years of admission are anatomy, physiology, and pathophysiologies. Students encountering this issue can easily satisfy the program science requirement by enrolling in HIT 116, Human Anatomy, Physiology, and Pathophysiology. If a student has these science required courses, and they were taken over 5 years ago, and are currently working in a healthcare career that utilizes this knowledge, they can reach out to the program director to discuss the consideration of transferring these courses. In your communication with the program director, you must explain your situation and provide any relevant documentation or proof of your healthcare career and how it relates to the required courses. It is important to provide as much information to support your request. The program director will review your request and consider factors such as the relevance of your previous coursework, your professional experience, and any other qualifications you provided. Students may be asked to take a proficiency exam to assure knowledge. Ultimately, it will be up to the program director to determine whether your previous coursework or professional experience meets the requirement for the required courses. In the last course, in the last semester of the program, you will be in a clinic rotation. HIT 285 Professional Practice Experience. This course serves as the culmination of students' dedication in acquiring knowledge and skills throughout the program and is exclusively offered during the fall and spring semesters in the B block, the last 8 weeks of the academic semester. Prerequisites for this course include achieving a grade of C or above in all HIT courses and maintaining a cumulative GPA of 2.5 or higher. It requires membership with a HEMA. $49 student membership is all you need. This membership is a student cost. We will review the HEMA domains that are covered throughout the program, and this will prepare students for the RHIT credential exam. We will provide hands-on experience with the clinic rotations. Students are required to complete 40 hours of clinic experience, which entails 1 8-hour per day for a total of 5 weeks. It will include a comprehensive program exam. This will assess program competencies and objectives. Instructor approval is required. The application for approval is announced in the last 2 semester HIT courses, and it's pushed to the student's Canvas dashboard in this same time frame. Students can enroll in HIT 285 while awaiting approval. Students enrolled in the course and who have not met course prerequisites or GPA will not be approved. Student will receive a notification email informing them that they have not met the course requirement and drop from the course. Student can reapply later once they have met the course requirements. HIT 285. Requirements after approval. The following must be completed before the start of students' clinic rotation. Immunizations. Students must complete immunizations required by the OTC affiliation agreements. Students are highly encouraged to begin compiling their immunization records early in the program so they will have all required immunizations completed before beginning HIT 285. Immunizations are a student cost. A criminal background check. Students will complete a criminal background check. This is included in the student fees. A random drug test. Students will be notified when to take their random drug test by the Health Sciences Office. This must be done within 30 days of the start of the clinic rotation. This is included in the student fees. My Record Tracker software portal. Students will receive instructions on the My Record Tracker portal from the Health Sciences Office. Through My Record Tracker, students will set up an account so they can submit their immunizations, participate in the criminal background check, and view the random drug test results. And the last of our key points are the assignment of clinic sites. The course instructor will be responsible for assigning clinic sites to students. If a student resides outside 60 miles of the OTC Springfield campus, students will be required to find their own clinic site. The instructor will assist students who need this assistance. Students are not allowed to complete their clinic rotation within their own organization's department. Students cannot be paid in their clinic rotation. Students are responsible for their own transportation to and from the clinic sites, and transportation is a student cost. We do have college navigators to help students along the way. When you apply to OTC, you will be assigned a college navigator specific to your program of interest. Your navigator can assist you with your academic plan, your financial aid, or scholarship. They are happy to help. Your college navigator is also available to help connect you with any non-academic resources you may need, such as hardship and emergency assistance. If you have questions, you always are welcome to contact Denise Baer, the HIT Program Director at baird@otc.edu. Thank you, and I look forward to seeing you in the program.